You are listening to the Journal of Rheumatology's Editor's Picks with Dr. Earl Silverman, Editor-in-Chief.
Hello again, this is Earl Silverman, Editor-in-Chief of the Journal of Rheumatology. Welcome you to the May 2026 edition of Editor's Summary. This month's in-depth interview of our highlighted paper will be by Dr. Sindhu Johnson, Section Editor for Systemic Sclerosis, who will be speaking to Drs. Ali Ayla and Sherwin Asasi on behalf of all the co-authors of their paper titled Association of Type 3 and Type 4 Collagen Neoepitopes with Disease Severity and Systemic Sclerosis.
So Sherwin, your work highlights correlations between collagen turnover markers and inflammatory pathways, including CRP, IL-6, and interferon-inducible proteins. How does this work reinforce or potentially reshape our current understanding of the inflammation-fibrosis axis in systemic sclerosis?
I believe that's one of the most interesting findings of this study because we actually had longitudinal measurements of both collagen neoepitopes and key inflammatory cytokines. At the baseline visit, both collagen formation and degradation markers showed statistically significant weak to moderate correlations with CRP, IL-6, and the composite score of serum interferon-inducible proteins, supporting the link between immune dysregulation and fibrosis in systemic sclerosis. We also measured the same inflammatory cytokines at the 6-month visit, enabling us to investigate whether percent change in collagen neoepitopes from baseline to 6-month visit correlated with the change in the inflammatory cytokine levels during the same time period. We observed that change in collagen degradation markers showed the highest correlation with the change in the general inflammatory marker CRP, supporting previous findings where antifibrotic drugs were used in clinical trials, showing that antifibrotic drugs lead to an initial transient increase in CRP, supporting the notion that breakdown of collagen might actually induce initially an general inflammatory marker such as CRP, which is produced by the liver. In contrast, the change in the serum interferon score showed the highest correlation with the change in the collagen formation biomarkers, PRO-C3 and PRO-C6, which was not observed with a change in CRP or IL-6. This finding provides additional evidence for the profibrotic effect of interferon pathway in systemic sclerosis.
I hope you enjoyed listening to part of the interview with two of the authors of the paper titled Association of Type 3 and Type 4 Collagen Neoepitopes with Disease Severity in Systemic Sclerosis. And we'll listen to the complete interview, which is available on our YouTube channel as well as the journal's website, which is www.jroom.org. I also suggest that you read the complete paper as well as an insightful editorial which accompanies the paper titled Collagen Turnover Biomarkers in Systemic Sclerosis. Can we capture the full fibrotic process from the blood? The editorial is by Dr. Muriel Elhai and Karina Mahaya from the University Hospital Zurich, University of Zurich, Switzerland, both of which are available at our website or in the print edition of the May 2026 edition of the Journal of Rheumatology. Now I will go on to review the other publications in the May 2026 edition. First paper is by Dr. Taylor Williams and co-authors, which is titled Association of Rheumatoid Arthritis with Post-Fracture Mortality and Fracture-Related Care. In a case control-matched retrospective cohort study of 1,304 patients with RA from Western Australia. The authors found that there was a higher rate of death after fracture with a hazard ratio of 1.28. The post-fracture survival did not change from the period 1990 to 1999 as compared to the years 2000 to 2010, although the death rate did decrease in the controls. The next paper is again on RA and is titled The Effect of Area-Level Socioeconomic Status on Disease Outcomes in Rheumatoid Arthritis. Results from an Australian longitudinal Inception cohort, and is by Russell and co-authors. In this study of 255 RA patients, 67% of which were female, the investigators found that a disadvantageous socioeconomic status was associated with higher disease activity, disability, and poor quality of life, despite the study being done in a treat-to-target era in a universal healthcare system. Now moving from RA to SLE, the next paper is by Benson and co-authors and is titled The Effect of Everyday Discrimination in Systemic Lupus Erythematosus Disease Activity and Mental Health Outcomes. Using data from 245 SLE patients in the California Lupus Epidemiologic Study, the authors found that everyday discrimination scores were higher among Black and Asian participants. Higher discrimination was associated with a poor SLAC score, PHQ-8 score, GAD-7 scores, as well as pain and fatigue scores. Discrimination was no longer significantly associated with SLAC, pain, or fatigue after adjusting for PHQ-8 or GAD-7. Mediation analysis suggested that mental health mediates the relationship between discrimination and patient-reported outcomes. Now move on to next paper titled The Patient Said. It's capital S, capital A, capital I, capital D, and it stands for Self-Administered Inflammatory Arthritis Study. And it is by Bill and co-authors. The authors evaluated the discriminatory referral performance of two validated questionnaires, the Early Inflammatory Arthritis Questionnaire and the Case-Finding Axial Spondylitis Questionnaire. This was done in 92 newly referred rheumatology patients in British Columbia, Canada. Of the 92 participants, 33 had a time-sensitive inflammatory arthritis, 38% had an other inflammatory arthritis, and 29% had a non-inflammatory arthritis. Only 7 patients had axial spondyloarthritis, precluding the discriminatory analysis of the case-finding axial spondylitis questionnaire. The Early Inflammatory Arthritis Questionnaire had an area under the curve of 0.586, sensitivity of 33%, and a specificity of 84%, suggesting that the Early Inflammatory Arthritis Questionnaire has utility in discriminating patients with inflammatory arthritis from those without. Now moving on to a pediatric paper titled Sex Differences in Promise Pediatric Depression Symptoms, Anxiety, and Psychological Stress Among Children and Adolescents Living with Pediatric Rheumatic Diseases. And it is by Randall and co-authors on behalf of the CARA Registry investigators. Among 393 children or adolescents with JIA in 58 with childhood onset SLE, depressive symptoms, anxiety, and psychological stress scores were higher, indicating poor mental health for girls as compared to boys. At baseline, approximately 1 in 3 girls with JAA and 1 in 2 girls with SLE had moderate to severe depressive symptoms and psychological stress compared to 1 in 6 boys with JAA or SLE. Significant sex differences persisted after adjusting for rheumatic disease activity, time, and other important variables. Mental health screening, management, and interventions may need to be tailored by sex. The next paper is by Cam and co-authors entitled How Physicians Manage Colchicine-Resistant Familiar Mediterranean Fever, Insights from a Multinational Survey in High Prevalence Countries. This survey of 126 clinicians said that in the absence of regulatory constraints, greater than 70% preferred canakinumab over anakinra for colchicine-resistant FMF. The majority, greater than 90%, considered the standard dose of 2 milligrams per kilo per day sufficient. Following control, they would taper dosing to intervals of every 3 to 4 months, while anakinra was tapered by extending the dosage intervals to weekly. The survey found that adult rheumatologists were more likely than pediatricians to support lifelong biological therapy and reported greater concerns regarding colchicine compliance. On-demand use of biologic also emerged as a treatment approach among all treating physicians. We now switch to the increasingly important issue of immune checkpoint inhibitor-induced rheumatic diseases with a paper titled Evaluating Hip Osteoarthritis as a Risk Factor for Immune Checkpoint Inhibitor-Induced Inflammatory Arthritis by Fitzpatrick and co-authors. The authors hypothesized that local inflammation and structural changes due to OA could predispose patients to an increased risk of immune checkpoint inhibitor-induced inflammatory arthritis by amplifying the local immune response in OA joints. However, what they found among the 39 patients in this study, 103 had hip OA, the cumulative incidence of immune checkpoint inhibitor-induced inflammatory arthritis did not significantly differ between those with and without hip arthritis OA, and was 54.8 per 1,000 patient years for the total cohort. Survival did not differ by hip OA status, but was improved in patients with immune checkpoint inhibitor-induced inflammatory arthritis and those with higher BMI. We now move on to a paper titled High Rates of Degenerative Changes in the Lower Spine in Calcium Pyrophosphate Deposition Disease Compared to Degenerative Disc Disease by Claudianu and co-authors. Of the 140 radiographs from CPPD patients as compared to the 99 from those with degenerative disc disease, demonstrated that there was significantly more disc calcification, osteophytes, and erosions in the CPPD group. Although follow-up radiographs showed significant progression of end plate erosions and osteophytes in both groups, thoracic erosive changes were more frequent in the CPPD cohort regarding lumbar disc despite a shorter follow-up time. These data show that it is clinically important to differentiate patients with CPPD versus those with degenerative disc disease, as the former was associated with more progressive and severe disease. Our expert review this month addresses the important issue of hydroxychloroquine ocular toxicity in a paper by Sitt, Mason, and Kaplan titled Expert Review, Hydroxychloroquine Ocular Toxicity, a Comprehensive Review. And this review covers hydroxychloroquine's history, the pharmacokinetics, and its ocular safety profile, with a major focus on risk of toxicity, the diagnosis, and screening for ocular toxicity. We also have a scoping review this month, and it is by Key and co-authors, titled The Burden of Enthesitis, Inflammatory Arthritis, and Tenosynovitis on Musculoskeletal Ultrasound and Systemic Lupus Erythematosus, a scoping review which summarizes the available literature on the role of musculoskeletal ultrasound in adults with SLE. This month's Panorama 360 Degrees of Rheumatology is a poem by Rudappadanman Singh, and is titled, Am I Lost? This month's research letter is by Earl and co-authors and is titled Normalizing Uricemia and Psoriatic Arthritis, a Hypothetical Reduction of Atherosclerotic Plaque Burden. The authors demonstrated that hyperuricemia correlated with aortic and global atherosclerosis in patients with PSA, and they did modeling which suggested that achieving normal uricemia might reduce plaque burden. There are two images in rheumatology this month. First is titled Calcium Pyrophosphate Deposition Disease-Induced Acute Dactylitis in the Elderly, a Clinical Ultrasound Mimic, and describes two women aged 81 and 82 years old with CPPD arthritis diagnosed several years earlier, but who had been in a prolonged phase of disease quiescence prior to presentation when they presented with acute dactylitis, which resolved with colchicine therapy. The second image is titled Uncommon Cause of Cerebellar Leukoencephalopathy Secondary to Low-Dose Methotrexate, which shows MRI images from a 65-year-old man who, after long-term methotrexate, presented with new-onset cerebellar leukoencephalopathy, as demonstrated by MRI. The follow-up MRI 11 months after stopping the methotrexate showed resolution of the cerebellar lesion. There are two case reports. First is refractory systemic sclerosis-related digital ulcers successfully treated with hyperbaric oxygen therapy, a case report and literature review, while the second is MAGIC, mouth and genital ulcers with inflamed cartilage of vexus, a case of overlap between Behçet's disease and vexus. I want to thank you for listening to this podcast and encourage you to read the complete text of the articles in the May 2026 edition of the Journal of Rheumatology. The articles are available either print or online edition of the journal, and the latter is available at www.jrheum.org. I encourage you to watch the complete interview of the highlighted article this month, but also if you have missed them from previous month's articles. They are available both at our website and on our YouTube channel. If you have any comments or questions of any of the articles in the May edition of the Journal of Rheumatology, you can direct them to me at esilverman@jroom.com or to manuscripts@jroom.com. And I hope you will join me for the June 2026 edition of Editor's Summary. Thank you.